Hi everyone, Dr. Dave here with Synergy Wellness. We have San here with us. San came in for a couple of issues, but I think it's a good case to go over because a lot of people suffer from neurological issues and don't really realize it's neurological. They think like, oh, this is just a pinched nerve. Well, that's neurological. A nerve is neurological. Nerve, neurological, right? A neurologist does what? Checks nerves, okay? Among other things, and neurological conditions typically, right? So you can have a problem in the lower part of your neck, the brachial plexus, and have neurological conditions or neurological deficits, numbness in the hands or fingers, weakness in the arms because the brachial plexus or the nerves in the base of the neck, top of the upper back, top of the shoulders there, control not only the sensations in the hands and fingers, but also the muscles in the hands and fingers. Same thing with the lower back. Now the lower back has a plexus of nerves, okay, in the lumbar region, in the low back region, and those nerves run down and control the sensation in the legs and calves and feet and toes, and also the muscles as well, okay? So like I had a patient this morning say, well, I don't understand why I have this pulling in my calf, and that pulling is not because your calf is tight. That's the sciatica. Especially if you're sitting and you feel that pulling, right? You're not moving, so why would it pull? It's definitely neurological because you're sitting. And the more you sit, the more you compress those discs. So she has neurological issues or deficits, numbness in the hands and fingers, and also in the legs and feet. And the number one technique for that is Cox Flexion Distraction Technique. Hands down, the number one chiropractic technique. Now, a lot of people say, oh, I've done chiropractic, it hasn't worked. Did you do Cox Flexion Distraction Technique? Probably not, okay? So a lot of doctors may have the table, doesn't mean they're certified either. So you wanna make sure it's done properly, and we do certified Cox Flexion Distraction Technique here at Synergy Wellness in New York City. And we have San here because she came in for both, right? In the neck and so numbness in the hands and fingers and in the legs and sciatica in the legs. So not just numbness in the legs, but she had pain, which is called sciatica, okay? So we're on visit, I don't even know what visit we're on. What visit are we on here?
Right now, so 5.
5, okay. So visit 5, and how are you doing?
It's a lot better. A lot better.
Good.
Can feel the difference, moving around.
Do you still have the leg pain right now?
Not in the leg anymore.
Okay, just in the lower back.
Yes, it's in like middle of the back.
Okay.
Yeah.
So right in the center of her lower back. So, 5 visits, that's great. We're looking for a minimum of 50% improvement in 4 to 5 weeks. Usually we get much better results than that. But when you have a neurological condition, don't expect this to go away in 4 or 5 visits at the chiropractor's office unless you think he's a miracle worker or God or Jesus or whatever, Mohammed, whatever. You cannot expect a long condition, a back condition that's gotten worse and been going on for years and years and years to go away in 5 visits. I'm sorry, that's just not going to happen. So at a minimum, we're expecting 50% results. Are we at 50% now or more?
Yeah, it's a little more than 50%.
More than 50%. And 5 visits, that's, we're on week 2 of her care. So we're not at 4 weeks yet. So give it some time. Give it 4 to 5 weeks and at least 3 to 2 times a week, okay, for 4 weeks. And that way you can give it a fair shake. So we're going to go ahead and do the flexion distraction technique on her right now. And I'm going to have you lay on your stomach. Now, let me ask you this. How's your neck? Because you have numbness in your hands and fingers. How's the numbness in the hands and fingers?
The back, lower body is way better than the upper
neck?
body. Yeah,
So you're
upper
still
body
having, the neck is a little bit slower?
Yes, a little bit slower.
How much improvement in the neck?
About 30%.
30%. Okay.
Yes.
We're on week 2 again, so we're still on track. By the end of week 4, we want to get 50% minimum improvement. So we're at 30% with our neck. We still have some work to do. So we're going to focus a little bit more on the neck today. But you guys are going to watch me do flexion distraction technique for her lower back. Okay? Now, I'm skipping some of the beginning stages, the tolerance testing and all that. So for any certified docs out there watching this, we've treated her already before. We're going to go right into the next protocol, right? She's doing really great, so we're gonna continue with what we're doing. I'm not gonna change a thing here. So I'm gonna start up higher for her, and we're gonna add a little distraction, a little y-axis distraction, so I'm stretching her out as I'm doing flexion, and we're opening up that back of that disc space where the sciatic nerve comes out from, the back of the vertebra, or the foramen, and opening up that space, giving that nerve more room to breathe freely without any irritation or chafing of that nerve. Also, while we're doing that, we're decompressing the disc. This is like traction and flexion at the same time. This is definitely the gold standard when you're dealing with pinched nerves, sciatica, which is a pinched nerve, any neurological issues, not necessarily every neurological condition, but when it's a pinched nerve in the spine or a neurological condition in the spine, absolutely. And then also stenosis, disc bulges, spondylolisthesis, post-surgical and pre-surgical cases. This is the gold standard technique and the most effective. In my 25 years of practicing, hands down, this is the most effective technique. And then if you couple that with a couple other therapies, it's extremely, extremely effective, especially for people that have had surgery, failed back surgery. We add cold laser therapy, and that's really effective. So that's a simplified view of Cox Flexion Distraction Technique. If you guys have any questions or comments, or are having some sciatica or numbness tingling down the legs, or stenosis, disc herniation, or a disc bulge, and you're considering this technique, you've been to other chiropractors before, it hasn't worked, I highly recommend Cox Flexion Distraction Technique. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't forget to subscribe. Appreciate you guys.